This is Dr. Chris Robertson providing an overview of lung cancer. When it comes to lung cancer, adenocarcinoma is the most prevalent type. African American men have the highest incidence and highest mortality. Morbidity and mortality are also higher in persons that have low incomes and less education. One of the things that is extremely important with respect to primary care providers have to do with annual screening. For adults that meet criteria, they should be screened annually with low-dose CT, and those are persons that are age 55 to 80. Persons with a 30-pack year smoking history and currently smoke, or if they have a 30-pack year history and have quit within the last 15 years. You typically stop screening once a person has not smoked for 15 years, or if they develop a health problem that substantially limits life expectancy or the ability or willingness to have curative lung surgery. I cannot emphasize the importance of screening. Historically, insurance made it challenging to get these screenings completed. I can't really speak to what the current trend is, however, recognize risk and when this needs to occur, and if prior authorization is required, make sure that the forms or whatever documentation is needed is provided so that insurance covers this as a part of wellness and prevention. When it comes to patients with lung cancer, some of the things that you see in history and or on your history and physical exam. Subjective, the patient may report fatigue, malaise, weight loss, anorexia, or poor appetite. There may be cough, wheezing, dyspnea, hemoptysis, and chest pain. You've also got some objective findings, which may include some enlarged supraclavicular or cervical nodes or masses. Also pleural effusion or wheezing. This is taken out of the text and includes some of the clinical manifestations of lung cancer that you may see in patients, and this does include a mixture of subjective and objective findings. Can be a variation of things, and so this is why each patient is different. You may have patients who have a few of these, some that have several, or some that really have none at all. From a diagnostic standpoint, early detection and staging is extremely important. As a primary care provider, when we focus on early detection and staging, there are obviously certain things that we will and will not do as primary care providers. Typically doing a CBC or doing labs to include CBC, CMP, a PT, PTT, doing an EKG, or doing pulmonary function testing is appropriate. It may also be appropriate if we're ordering a chest x-ray or chest CT if there was something abnormal on chest x-ray, or if we're doing sputum cytology. Typically, when it comes to any type of bronchoscopy, any type of bronchial washings or brushings, or fine needle aspiration and biopsy, that's typically done by specialists or where we have referred the patient out. When it comes to treatment and follow-up, obviously, options for lung cancer can include surgery, can include chemo and radiation. Again, that depends on the stage of disease and what other comorbidities the patient may have. When it comes to how we educate these patients, a lot of it has to do with where the patient is and what information they need. Smoking cessation is again a big component, as well as exposure to any type of carcinogenic substances, and that could be occupational as well as environmental. Lifestyle, want to emphasize fruit and vegetables, making sure that they are intaking these things, and by doing so, by focusing on fruit and vegetable consumption, there's obviously more tendency, more behavior towards a healthier diet and less sugary foods and beverages. Also recognizing end-of-life care or even palliative care. Palliative care is not always necessarily hospice, but sometimes patients that I've heard it stated that some types of cancers they try to manage as though it's a chronic disease. And so looking at palliative care, and if the person has cancer and they have particular symptoms, being able to manage those symptoms through palliative care. And if it gets to the point where hospice is needed, then end of life care. Self-care is extremely important. Demonstration of self-care techniques, particularly in patients who may have PORTS or other components of care where they have to care for themselves, or they have family members or caregivers that also need to participate in care. This here is taken from your text, and it provides an algorithm that shows specifically small cell lung cancer. So you can see again the overview of some of what occurs in the primary care setting. And again, in these instances, when we see these patients, we don't always have the answers. We typically may see abnormalities on imaging or perhaps lab that we then have to refer the patient out for further diagnostics. And we would see them back in our office for follow-up to make sure that they follow through or to manage their other chronic condition. That concludes the content for lung cancer.